All right. So this scenario is about clinical reasoning, obviously an important skill that every therapist needs to know, but I think especially from an orthopedic standpoint, we have patients coming in that just tell us they have knee pain or back pain, and that's all we know. So I think these skills are tantamount or paramount for us because we really have to be able to figure out, is this patient even appropriate for physical therapy? And if it's something else more sinister and nefarious going on. So if we look at these scenarios, I think what you want to do when you look at a scenario is you want to try to find the key points of that scenario and that are going to help you answer what you think questions might be. So if we look at this first scenario, things that pop out to me, I have it on paper here and I've actually highlighted. Things that pop out to me, Daniel's a physical therapist resident. So that's something I want to know because he's not an experienced therapist with 20 years of experience, or he's not a student, he's a resident. So that gives us a little insight into where he is and what his knowledge level is. It says he's 3 months into a residency, so that's something I'd want to know. And then they get into, after that first sentence, they get into the patient. So they say his first patient's 57 years old. Anytime you're given an age, that's something I want to know because there are certain conditions that are more likely to happen at certain ages. So if someone is 16, that's different than if they're 76 or if they're 6 or anything like that. So age is something I always want to know. So that's something that came to me. In this scenario, they give us a diagnosis. They say we have a diagnosis of osteoarthritis of the right knee and of the left knee. So that's certainly something I want to know because osteoarthritis should mean some things to us. We should start thinking about presentation and what a patient might report and what we might want to do treatment-wise. So that's something that certainly is something that I think is worthwhile to highlight. We talk, and then it talks about the interview here, and it talks about the patient's concerns, which are always important. Patient goals are definitely important. It talks about the pain getting worse over a couple of years, and he's had pain for 8 to 9 years. Again, those are important facts to me because it talks about how the symptoms are behaving and how this condition is progressing. And this is not someone that's coming in that just had 2 months. So that 8 to 9 years is important to me. Talks about how he lives. He lives alone in an apartment. That's important because if there's a question about help at home or assistance, we need to know that he lives alone and he's got stairs. So that's obviously important as well. Then we start to, it talks about his job, and he worked for 27 years. And again, it describes his symptoms. So those are things that we want to highlight. It talks about his past medical history, which is always important as well. In this case, he has type 1 diabetes. That can be important for comorbidities, or we know certain conditions are more prone to having certain comorbidities, or if they work together, that can certainly be an issue for us. So we definitely want to pay attention to those type of facts. It mentions hypertension. It talks about him being overweight. So he's a smoker. So that's always a big thing when you're given information about smoking. And then it just talks about his goal for physical therapy, that it's getting worse and he wants to get back to exercising. So that kind of sums up the scenario. And to me, those are the key points when I read it that really jumped out to me, that I said, these are things that I really want to attend to because I think I'm going to need these to answer questions. And then if we start to get into the questions, this is a clinical reasoning scenario. So it's not really about the diagnosis and about the physical therapy piece. It's about the clinical reasoning piece. So first question asks us, which of the following would be the best thing for Kira to do next to facilitate Dan's clinical reasoning? Kira is his mentor in the clinic. And if you look at those choices, again, you have to know clinical reasoning. So for this, it's probably a lot of definition and knowledge-based information that you need to know. So we look at those choices, and again, we can see that the correct answer is C, asking Dan to report his interpretation. So if you look at some of the other choices, they're kind of guided choices, and they don't really let the resident, in this case, Daniel, get to a thought process. The correct answer says, we're going to go through this evaluation, and then you're going to ask him, what do you think? A nice open-ended question, and you get to see his thought process and what his clinical reasoning is. And that's going to help us because we can see where someone may go awry, or we know what they're thinking, and that can help us help them. All the other choices, again, are a little more guided. So for example, choice A, it says, show Daniel her checklist to facilitate identification of what she thought was wrong. That doesn't really help someone learn. If you just say, here's what I thought, you kind of want to hear what they have to say, and then you can kind of compare after that. So when we look at this item, the best choice is ask the resident for his interpretation of it, and then you can go from there. And it also lets us see, it speaks about it in the explanation about his self-assessment skills. So when we ask someone, what did you think? we hear what they have to think about it. We see how they're assessing themselves and how they're doing with this process, and that also helps us get into helping them and figuring out where did they go off track, and where can we kind of give them some guidance. So that's kind of what that first item gets to. We look at the second item, and it asks, well, first of all, we get some more information. So we have a question that the mentor asked the patient, and then he was asked, how did you determine if you really understood the patient's problem? So the mentor asked the resident, how did you understand if you really understood the patient's problem? And then he just said, it just seems so obvious, as what's written in this scenario here. And then the item gets to this clinical reasoning skill, talks about which one of the following clinical reasoning errors did the resident commit? And the answer is superficial psychosocial assessment. It basically means he made an assumption. He made an assumption based on kind of how the patient presented and what the patient said. And he just said, oh, well, I assume that he's going to have this, or I assume that this is what he's going to be thinking, rather than ask. So we never want to make assumptions. We know the saying about assumptions. So the mistake he made there was, again, he made a superficial, just based on a couple of pieces of information without obtaining more information about what this patient was, how the patient was going to present, what the patient wanted to get out of therapy. And that's really, really dangerous, because we want to be on the same page with patients. If patients have a certain goal and they want to try to obtain something or get to some level, we want to be sure that we're on the same page, because maybe that's not feasible, and we want to explain to them why we don't think it's feasible. Or if we think it is feasible, we want to say, great. And then we're both working toward that same goal. So to answer this question correctly, it's, again, basically a knowledge-based question. When you look at the other choices, premature anchoring, commission bias, approaching narrative, reasoning inductively, you just kind of have to know what those terms mean. So it's worth your while to spend a little bit of time reviewing what those terms mean, so that you know what they are. So again, more of a definition-based question here. And same thing for this third question. It asks, which of the following would be the next best step for the mentor to take to improve the resident's learning process? And in this case, the correct answer, so again, it gives answers about being guided. There are answers that say the mentor is going to teach the resident how to do things. The resident's going to model how to do things. Whereas the correct choice, discuss his ideas for concrete strategies, or what he could use to improve his clinical reasoning. That's what we want to get to, because now we are asking the resident, what do you think you could do? And again, it helps with this whole clinical reasoning skill, because now the resident's going to tell us, I think I could do this better. I think I should do this next time. And if we agree with that, we can say, great. If we don't, we can ask them, well, why would you do that? And see what their reasoning is behind it. So again, the best way to approach this is to ask the resident what their ideas were and for how they could improve, and then discuss those. And again, if we look at the other choices, it's a little more passive on the resident's part. Teaching him how to do this, that's not really going to help him. Asking him to review common clinical errors, that may be a second step, but that's not the best answer. And modeling for him how he could do that, that's not great, because then what's he going to do? He's just going to copy the mentor, most likely. And just like if you have a student in the clinic and you ask a student, why are you doing that? You don't want the student to say, well, that's what the CI did. You want the student to know, I'm doing this because we're trying to improve joint mobility, so we can improve range of motion, so we can walk the stairs better, or something like that. We want to have a reason behind it. So discussing the resident's concrete ideas is really going to help him improve his clinical reasoning process. And that's what we're trying to get to here. And that sums up this first scenario, this clinical reasoning scenario, with these few questions. So again, if I can sum it up really quickly, for a clinical reasoning piece, a lot of this might be knowledge level. If there were some terms that are in this scenario that I mentioned in this little tutorial that you were unaware of, you just have to go and obtain that knowledge. Portney and Watkins is a great reference for this, and you can probably just Google some of these terms as well. But knowing these terms help you with the clinical reasoning skill as well. So that's probably what sums up this scenario the best, I think.